Diabetes, the night signs that are silently destroying your health. Have you ever woken up in the middle of the night feeling uncontrollably thirsty or wondering why you're going to the bathroom so often? Could those cramps or that uncomfortable feeling in your legs be more than just bad posture during the day? And what about that night when you woke up sweating as if you were in a desert? Your body may be trying to tell you something important, and ignoring these signals can be costly to your health. Diabetes, a condition that affects millions of people around the world, can manifest itself silently, especially at night. Night signs are often overlooked, but they are clear warnings that something is not working as it should. In this text, you will discover what these signs are, why they happen, and how to act to avoid further damage. Let's get started. Do you get up many times to urinate during the night? Understand what is happening. Getting up several times during the night to urinate may seem like just a temporary discomfort, but it can be one of the first signs that something is not right in your body. This condition, known as nocturia, is directly related to excess blood sugar, a common problem in people with diabetes. When blood sugar levels are high, the kidneys work double time to filter and eliminate this excess. This process causes the body to excrete sugar through urine. But along with it, large amounts of water are eliminated, which increases the need to urinate. Furthermore, this constant loss of fluids can lead to dehydration, creating a vicious cycle. The more you urinate, the more dehydrated you become, and the greater the need to consume fluids. Imagine waking up 10 times in a single night to go to the bathroom. This not only interrupts your sleep, but also directly affects your quality of life, leaving you tired and without energy to face the day. A poor night's sleep compromises concentration, mood, and even the immune system, which depends on adequate rest to function well. It is essential to pay attention to this symptom and seek medical advice to check blood glucose levels. With the correct diagnosis and an appropriate treatment plan, which may include adjustments to diet and hydration, it is possible to control this problem and significantly improve the quality of your sleep. The non-ending thirst. Why do diabetic people feel so hungry for water? Feeling thirsty is natural, especially after a hot day or a salty meal. But what happens when this thirst becomes incessant, to the point that you consume glasses and glasses of water without being able to feel satiated? This is another classic sign of diabetes, known as polydipsia. The reason for this extreme thirst is directly related to excess blood sugar. When the body tries to eliminate excess sugar through urine, it also loses large amounts of fluid. This loss causes significant dehydration, which makes you constantly feel thirsty. Furthermore, in diabetes, the body has a tendency to retain sodium, which further intensifies the sensation of thirst. It's like an endless cycle. You drink more water to hydrate, urinate more frequently, and continue to feel thirsty, as the body cannot balance these processes. This insatiable thirst can be a huge inconvenience, especially at night, interrupting your sleep and leaving you even more exhausted. But more than that, it's a sign that your body is on high alert, desperately trying to deal with high glucose levels. Controlling excessive thirst requires more than simply drinking water. It is essential to treat the root cause of the problem: blood sugar imbalance. Consultation with a healthcare professional is essential to establish strategies such as dietary changes and physical activity, which help reduce glucose levels and, consequently, alleviate this symptom. Remember that ignoring extreme thirst can lead to more serious complications, such as severe dehydration and kidney problems. So if you've been feeling a thirst that never seems to go away, be sure to seek help. Your legs won't stop? What does restless leg syndrome have to do with diabetes? Imagine lying down at night, ready to rest, but your legs seem to have other plans. They move involuntarily, causing discomfort and making it difficult to sleep. This sensation, known as restless leg syndrome, may be directly linked to diabetes. Diabetes, especially when uncontrolled, can cause a deficiency in essential nutrients such as vitamin B1 and magnesium. These deficiencies interfere with the functioning of muscles and nerves, leading to the accumulation of lactic acid in tissues. This buildup prevents your muscles from receiving enough oxygen, resulting in feelings of restlessness and tiredness in your legs. Restless leg syndrome is also associated with high blood sugar levels, which worsen oxidative stress in muscles and nerves. This stress can leave your legs in a constant state of discomfort, especially at night when your body should be relaxing. In addition to physical discomfort, this condition seriously affects the quality of sleep. People with restless leg syndrome often have difficulty falling asleep or stay awake for long periods of time, which can lead to exhaustion and compromise their productivity and well-being. To alleviate this symptom, it is essential to reduce the consumption of refined carbohydrates and sugars, as they are the biggest causes of vitamin B1 deficiency. Using magnesium and B1 supplements can help improve muscle and nerve function, providing relief from restless legs. However, these measures must be accompanied by professional guidance, as each body responds differently. If your legs won't stop at night, don't ignore the sign. This could be a clue that your body is asking for urgent changes to avoid major complications. Burning and pain in the feet, the mystery of diabetic neuropathy. Have you ever felt an uncomfortable burning sensation or a strange pain in your feet to the point where you couldn't even sleep? Or maybe your feet feel numb, like they're off. These sensations may be signs of diabetic neuropathy, a common problem in people with diabetes. Diabetic neuropathy occurs due to excess glucose in the blood, which damages peripheral nerves, especially those in the extremities, such as the feet. This condition can manifest itself in several ways: pain, burning, tingling sensation, or even a total loss of sensitivity. It's as if the nerves become confused, sending wrong signals to the brain. At night, symptoms tend to intensify. This happens because when lying down, there is a greater concentration of blood in the extremities, which increases the pressure on already compromised nerves. This discomfort can make sleep virtually impossible, affecting not only quality of life, but also overall health. The good news is that there are ways to alleviate these symptoms. A combination of vitamin treatments, such as benfotiamine, a type of vitamin B1, and alpha-lipoic acid, can help repair nerve damage and improve sensation in your feet. Furthermore, controlling blood glucose levels is essential to prevent the progression of neuropathy. But it is important to remember that no treatment replaces lifestyle changes. Adopting a balanced diet rich in nutrients, reducing sugar consumption, and practicing physical exercise are fundamental steps to controlling diabetes and minimizing nerve damage. If you feel pain or burning in your feet, don't ignore it. Seek medical advice as soon as possible to prevent neuropathy from progressing and causing irreversible complications. Night cramps? Discover the link with diabetes and how to solve it. Waking up in the middle of the night with an intense cramp in your legs or feet is a painful and frustrating experience. While this may seem like just a momentary discomfort, for many people with diabetes, it's a sign that something deeper is going on. Night cramps are often associated with magnesium deficiency, a mineral essential for muscle relaxation. In diabetes, high blood sugar levels cause the body to excrete more magnesium in the urine, creating an imbalance between magnesium and calcium. While magnesium relaxes muscles, calcium is responsible for contraction. When there is too much calcium and not enough magnesium, muscles enter a constant state of tension, resulting in painful cramps. Furthermore, dehydration, common in people with diabetes due to frequent urination, further aggravates the problem. With less fluid in the body, muscles become more prone to spasms and involuntary contractions. To relieve and prevent night cramps, it is essential to focus on electrolyte balance. Magnesium supplements, especially in the form of magnesium glycinate, can be an effective solution as they not only help relax muscles but also improve sleep quality. However, replacement must be done under medical supervision to avoid excess, which can cause other problems. In addition to supplements, it is important to hydrate properly and adopt a diet that includes foods rich in magnesium, such as spinach, avocado, and nuts. Reducing your consumption of sugar and refined carbohydrates is also crucial to prevent magnesium loss and control glucose levels. If cramps are keeping you up at night, pay attention. They are not only uncomfortable, but a clear warning that your body needs attention to avoid major complications. Can't stop sweating at night? Diabetes may be the reason. Waking up in the middle of the night with sweat running down your face or neck, even if the room is cool, can be uncomfortable and worrying. This night sweat, often mistaken for symptoms of menopause or excessive heat, can be a clear sign of a blood sugar imbalance caused by diabetes. Night sweats occur when the body enters a state of heightened stress, known as the fight or flight response. In the case of diabetes, this can happen with both high and low blood sugar levels. When glucose is low, the body releases adrenaline in an attempt to raise sugar levels. This increase in adrenaline activates the sympathetic nervous system, which regulates sweat, leading to excessive sweating. Additionally, diabetes can cause a state of sympathetic dominance, in which the body remains on constant alert, even during sleep. This hyperactivity of the nervous system is a reflection of the body's difficulty in dealing with metabolic imbalances caused by excess glucose. To deal with night sweats, it's crucial to control your blood sugar levels, especially before bed. A low-carb diet and well-planned meals can help prevent overnight glucose swings. It is also recommended to avoid eating sugary foods or foods rich in simple carbohydrates before going to bed, as they can cause spikes and drops in blood sugar. If night sweats persist, it is important to consult a healthcare professional. You may need to adjust your medication or monitor your glucose levels more closely to identify patterns that may be triggering these episodes. Remember, sweating at night may seem trivial, but it's a sign that your body is overworked trying to compensate for imbalances. Don't ignore this symptom. Sleep apnea, the hidden effect of diabetes on your breathing. Have you ever heard of sleep apnea, the condition where breathing stops repeatedly during the night? If you have diabetes, this problem may be more common than you think. Sleep apnea is more than a nuisance. It's a sign that your body is struggling to maintain balance. In people with diabetes, sleep apnea is often caused by too much insulin in the body, a result of a condition called insulin resistance. This excess not only contributes to weight gain, but also leads to the accumulation of fat in the neck and throat area, which can obstruct the airways during sleep. The lack of oxygen caused by apnea not only affects sleep, but also worsens diabetes. When the body notices shortness of breath, it enters a state of stress, releasing hormones such as adrenaline and cortisol. These hormones further increase blood glucose levels, creating a vicious cycle between diabetes and sleep apnea. Symptoms may include loud snoring, a feeling of suffocation during sleep, extreme tiredness upon waking, and difficulty concentrating throughout the day. Additionally, untreated apnea can increase the risk of heart problems and high blood pressure, complications that are already a concern for people with diabetes. To address sleep apnea, it is critical to address insulin resistance and the factors that contribute to weight gain. Adopting a low-carb diet combined with regular exercise can help reduce insulin levels and, consequently, weight. In more severe cases, the use of devices such as CPAP, continuous positive airway pressure, may be necessary to ensure adequate breathing during the night. If you suspect you have sleep apnea, be sure to seek medical advice. Treating this condition not only improves sleep quality, but also helps control diabetes and prevent long-term complications. Hypoglycemia, the hidden enemy that interrupts your sleep. Have you ever woken up in the middle of the night feeling anxious, sweaty, or with a racing heart? These could be signs of nocturnal hypoglycemia, a drop in blood sugar levels that interrupts your rest and puts your body on alert. Hypoglycemia occurs when the blood glucose level drops below that needed to maintain body functions. In the case of people with diabetes, this can happen due to excess insulin or inadequate release of glucose from the liver during the night. This drop activates the body's fight or flight system, releasing adrenaline and cortisol, hormones that increase glucose quickly, but which also cause agitation and difficulty going back to sleep. Symptoms include cold sweats, tremors, feelings of intense hunger, and even nightmares. Additionally, nocturnal hypoglycemia can be dangerous if left untreated, as the brain depends on glucose to function properly, and very low levels can cause confusion or even loss of consciousness. To avoid episodes of hypoglycemia, it is crucial to carefully monitor glucose levels, especially before bed. Eating a light snack with protein and complex carbohydrates can help stabilize sugar levels throughout the night. On the other hand, it is essential to avoid foods rich in sugar or simple carbohydrates before going to bed, as they can cause glucose spikes followed by sudden drops. Furthermore, adjusting medication or insulin with the guidance of a healthcare professional is essential to balance glucose levels and avoid nighttime crises. If you have been waking up frequently with symptoms of hypoglycemia, don't ignore it. This is a sign that diabetes treatment needs to be adjusted to ensure your safety and quality of life. Difficulty sleeping? Blood sugar may be the villain. You lie in bed, but sleep doesn't come. Hours pass, and you keep tossing and turning, frustrated and exhausted. This difficulty sleeping may be related to high blood sugar levels, a common problem in people with diabetes. High glucose levels can interfere with the production of melatonin, the hormone responsible for regulating sleep. When your blood sugar is out of control, your body finds it difficult to get into its natural resting rhythm, leaving you awake for longer. Furthermore, glucose spikes caused by inadequate nutrition before bed can create a state of internal agitation, making it difficult to relax and fall asleep. Another factor is the impact of diabetes on the nervous system. An imbalance in sugar levels can cause hyperactivity in the sympathetic nervous system, leaving the body on alert, as if prepared to react to a threat. This condition prevents relaxation and hinders the transition to deep sleep. To improve sleep quality, it is essential to adopt a routine that stabilizes glucose levels before bed. Avoid heavy meals or meals rich in simple carbohydrates at night, opting for foods that promote energy balance, such as lean proteins and vegetables. Additionally, creating a calm, dark environment in the bedroom can help regulate melatonin production. If difficulty sleeping persists, consulting a healthcare professional is essential. In many cases, adjustments in treatment or diet can make all the difference in ensuring restful nights of sleep. Remember, sleep is a vital part of your health. Don't let diabetes steal this essential moment for your well-being. Night reflux. What does diabetes do to your stomach? Do you feel that uncomfortable burning sensation rising in your chest as you try to sleep? Or do you need to stack pillows to avoid discomfort caused by reflux? This problem, known as gastroesophageal reflux, can be worsened by diabetes. Reflux occurs when the valve that separates the stomach from the esophagus, known as the lower esophageal sphincter, does not work properly. In the case of diabetes, this may be linked to the disease's impact on the autonomic nervous system, which controls involuntary functions such as digestion. High glucose levels can damage these nerves, impairing the valve's ability to stay closed and allowing stomach acid to back up into the esophagus. Reflux is more intense at night, as the horizontal position facilitates the return of acid. Furthermore, eating a diet rich in carbohydrates and sugars at night can increase the production of acid in the stomach, intensifying the problem. To reduce nocturnal reflux, adjusting your diet is essential. Avoid large or heavy meals before bed, especially those rich in acidic, fatty, or high-sugar foods. Choosing lighter meals and consuming foods rich in fiber can help improve digestion and reduce acid production. Another important habit is to avoid lying down right after meals. Allow at least 2 to 3 hours between your last meal and bedtime. Sleeping with your head slightly elevated can also help prevent reflux, making it easier for acid to retain stomach acid. If reflux persists, seek medical advice. It can be a sign that diabetes is affecting more than just your blood sugar levels, and proper treatment can improve both your reflux and your overall health. Think about it. Restful sleep starts with a healthy digestive tract. Don't ignore the signs that reflux is giving you. Can't escape the nightmares? Understand the relationship with diabetes. Recurrent nightmares or vivid dreams may seem like just a figment of an agitated imagination. But in people with diabetes, they can be signs of an imbalance in blood glucose levels. These nocturnal episodes are often associated with hypoglycemia, a drop in blood sugar levels that occurs during sleep. When this happens, the brain, which depends on glucose to function, goes into a state of alert. This state can lead to intense brain activity, manifesting itself through vivid dreams or nightmares. Additionally, low levels of vitamin B1, common in people with diabetes, can interfere with the production of neurotransmitters essential for brain relaxation. This deficiency contributes to greater mental agitation, intensifying disturbing dreams. On the other hand, high glucose levels can also affect sleep quality. They increase metabolic activity in the brain, making it difficult to transition into the deeper stages of sleep where dreams are less frequent. To reduce the occurrence of nightmares and vivid dreams, it is crucial to stabilize glucose levels before bed. Consume light and balanced meals, avoiding foods rich in sugar and refined carbohydrates in the evening. Vitamin B1 supplements, when recommended by a healthcare professional, can help balance brain activity and improve sleep quality. Additionally, it's important to regularly monitor your glucose levels, especially if you have frequent episodes of nightmares. They may be a sign that your diabetes treatment needs to be adjusted. Nightmares can be more than just bad dreams. They are a warning that something is not right. Don't underestimate these signs. Seeking balance in blood sugar is essential to ensure a peaceful and restful rest. Doesn't your body slow down? What nighttime high pressure means. While we sleep, the body is supposed to relax, reducing heart rate and blood pressure. But for many people with diabetes, this doesn't happen. Blood pressure remains elevated at night, a condition called non-dipping. This sign could indicate that something serious is happening. In people with diabetes, uncontrolled blood glucose levels contribute to stiff arteries and hyperactivity of the sympathetic nervous system. This prevents the natural relaxation of blood vessels during sleep, keeping blood pressure high. This problem is worsened by high blood insulin levels, characteristic of people with insulin resistance. This persistent high blood pressure can have serious consequences, including an increased risk of cardiovascular disease, kidney damage, and even stroke. Furthermore, the lack of adequate relaxation during the night increases the feeling of tiredness and exhaustion when waking up, damaging the quality of life. To deal with high blood pressure at night, it is essential to adopt measures that control diabetes and promote relaxation of the cardiovascular system. A low-carb diet, Regular exercise and maintaining a healthy weight are key strategies. In some cases, medications may be needed to control both glucose and blood pressure. It's also important to monitor your blood pressure regularly, especially if you experience symptoms such as headaches or extreme tiredness when you wake up. Identifying and treating the problem early can prevent serious complications. If you suspect your blood pressure is high at night, don't ignore this sign. It's a reminder that your body needs attention to regain balance and protect your health. Palpitations in the middle of the night? A clear sign of imbalance in the organism. Have you ever woken up in the middle of the night feeling like your heart is racing? These palpitations may be more than a reflection of a bad dream. They may indicate an imbalance in the body caused by diabetes. In the case of people with diabetes, nocturnal palpitations are often associated with electrolyte deficiency, especially magnesium and potassium. These minerals are essential for the proper functioning of the heart and muscles. When glucose levels are high, the body eliminates electrolytes through urine, creating an imbalance that affects heart rhythm. Additionally, overnight blood glucose fluctuations can cause adrenaline spikes, putting the body on alert and speeding up the heart rate. This mechanism, known as the fight or flight response, is the body's attempt to stabilize glucose levels, but it can interrupt sleep and cause great discomfort. To prevent nocturnal palpitations, it is essential to focus on glycemic control and electrolyte balance. A diet rich in foods like avocados, bananas, leafy greens, and nuts can help replenish magnesium and potassium. Specific supplements, recommended by a healthcare professional, can also be an effective option. Additionally, avoiding foods high in sugar before bed is crucial to stabilizing glucose levels and preventing adrenaline spikes. Staying hydrated is also key, as dehydration can worsen electrolyte imbalances. If palpitations persist, it is essential to seek medical advice. They may be a sign that diabetes is affecting more than just glucose levels, requiring treatment adjustments. Don't underestimate the impact of these palpitations. They are a reminder that balance in the body is essential for a healthy life and restful night's sleep. Do you rinse your teeth while you sleep? The blame may be diabetes. Waking up with jaw pain or discovering that you have a habit of grinding your teeth at night may seem harmless. However, bruxism, as it is known, may be related to diabetes and the impact of this condition on the nervous system. Diabetes affects the balance of the autonomic nervous system, which controls involuntary functions such as muscle relaxation. When blood sugar is out of control, the body can enter a state of constant stress, activating the sympathetic nervous system, responsible for the fight or flight response. This state of alertness during sleep can lead to involuntary tensing of the jaw muscles, resulting in teeth grinding. Additionally, blood glucose fluctuations, especially rapid spikes and drops, can trigger bruxism. These metabolic changes leave the body in a cycle of agitation even during sleep, intensifying the habit of grinding your teeth. Untreated bruxism can have serious consequences, including tooth wear, frequent headaches, muscle tension, and even temporomandibular joint (TMJ) problems. These symptoms can further worsen sleep quality and general well-being. To deal with diabetes-related bruxism, the first step is to stabilize blood glucose levels. Adopting a balanced diet, reducing sugar consumption, and following the treatment plan prescribed by your doctor are essential. Additionally, wearing dental plates at night can help protect your teeth from wear and tear. If bruxism persists, it is important to consult a dentist or specialized health professional to assess the need for additional interventions. In many cases, combined treatment of diabetes and bruxism can bring significant relief. Remember, grinding your teeth at night is a sign that something needs attention in your body. Don't ignore this symptom. Wake up with a headache? Discover how diabetes is related. Waking up with a headache first thing in the morning can be a sign that something is not working well in your body. For people with diabetes, these pains can be directly linked to imbalances in blood glucose levels and dehydration. When sugar levels are high or low at night, the brain suffers the consequences. In the case of hyperglycemia, excess glucose in the blood can cause dehydration as the body tries to eliminate excess sugar through urine. This loss of fluids reduces blood flow to the brain, resulting in headaches. On the other hand, episodes of hypoglycemia can also trigger morning pain. During a significant drop in sugar levels, the body releases hormones such as adrenaline and cortisol to stabilize glucose. These hormones, in addition to causing agitation, can increase pressure in the blood vessels in the head, causing pain. Another factor that contributes to headaches in people with diabetes is a lack of electrolytes, such as potassium and magnesium. Deficiency of these minerals, caused by excessive elimination through urine, affects muscle and nervous functioning, which can worsen discomfort. To prevent these pains, it is crucial to focus on adequate control of glucose levels. Staying hydrated throughout the day and consuming foods rich in electrolytes can help prevent dehydration and minimize the risk of morning aches and pains. Additionally, monitoring glucose levels before bed can be an effective strategy to avoid spikes or drops during the night. If headaches persist, it is essential to seek medical advice. They can be a warning that diabetes treatment needs adjustments, or that there are other factors at play that deserve attention. A headache upon waking up should not be ignored. It is yet another reminder that taking care of your health as a whole is essential to living well with diabetes. Now that you know the signs that diabetes can manifest at night, it's time to take action. Your body is an incredible machine, capable of sending alerts when something is not right. Listening to these signs and taking necessary action is the first step to protecting your health and ensuring a restful night's sleep. Remember that lifestyle changes, such as a balanced diet, regular exercise, and medical supervision, can make all the difference in controlling diabetes. Don't let yourself be overcome by challenges. Every small victory is a step towards a healthier and more balanced life. You have the power to transform your routine and proactively take care of yourself. Seek help. Get informed and make informed decisions. Diabetes control is not just about numbers, but about quality of life. Take care of yourself today to ensure a better tomorrow. Your well-being depends on the choices you make now. Trust in your ability to change and live fully, even in the face of challenges.